I'm not sure I 100% agree with you about there is no better system once you get into it. First of all, you are correct that getting into it is difficult. Well, you're into it once you see your general practitioner who says, yes, you've got something. I need to refer you to a specialist. Oh, when would that be? Next week? Oh, no.
No, it's down the road, no doubt.
It's going to be a long time. And once you get to the specialist who's, taking appointments for 6 months out, and please don't do this, ladies and gentlemen. I know there are some of you who will be saying, 6 months, what are you talking about? It was 9 months from GP. It was a year from GP to specialist. We know. I was trying to be generous. But once you get to the specialist, well, then you're looking at another lengthy period of time. So there should be, I noticed that there are other countries where this is not the case. And they're not all the sort of the socialist utopias that you might expect. Some of them are pretty hard-nosed countries but they found a way to get it done. That's what we need to do in Alberta, is find a way to get it done.
Yeah, and it's certainly it's the province's biggest expense, yes. And we're not getting any better outcomes than other jurisdictions. I know Corey's talked about it on his show that you look over, there are other ways of doing it that seem to produce better outcomes.
Well, there certainly are, and the one that struck me as the most likely to be effective was the one that Ralph Klein, God rest his soul, Ralph Klein did a lot of good things, but he brought in Bill 11.
The third way.
That meant that you couldn't start a private hospital in Alberta. We should have opened the gates to private healthcare, brought them in, and then had a bidding war to get the procedures done that needed to be done. I was traveling some years ago, ended up in Jordan of all places, and driving down the street, I couldn't help noticing the hospital, clinic. That little country has built itself up an enviable reputation as the place to go to get treated quickly. Jordan, you wouldn't think so, would you? But there it was. And they drew their trade from all over the Middle East and Europe. And they've done exactly what we should have done in Alberta. They have attracted the medical profession to come and set up right there. And now, of course,
same things happened in Mexico with dental work.
Algodones.
Yes, yeah. Right. I mean, you're just across the border and you see nothing but dental clinics. So and you see nothing but Canadians lined up in front of them.
That's right, and it's not that our dental service is so bad. I mean, you make an appointment, you go in, you get done. It's just that it costs you about 3 times what it cost you, and you can have a holiday for what you save on the trip to Mexico. So they tell me. One other thing, though, Dave. Sorry, what were you going to say?
I was just going to say we've started the process, but it's like drip. Where okay, now you can go to a private clinic and get your eyes done, or your knees done, or your hips done, and it all gets billed back to Alberta Healthcare Services. And in theory, that should shorten the wait list for everybody else. Doesn't seem to have cut it tremendously, but you're right. If we'd have done what. Instead of Bill 11, done the opposite and attracted private hospitals, we would have been in a lot better position than we are now.